Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Staphylococcus Epidermidis under the section of infectious diseases. So, in terms of the epidemiology of this bacteria, the majority are actually normal skin flora. Therefore, as a result of this, they frequently lead to false positive results on blood culture bottles. Gram-positive bacteria, they appear crystal violet under the microscope, and they are novobiocin sensitive. The associated diseases with Staph epidermidis include prosthetic joint infections, prosthetic valve endocarditis, peritoneal dialysis catheter infections, cerebrospinal shunt infection, long line infection, and indwelling catheters. The management of it really is surrounding two things. Number one is removing of the offending agent that is infected, which is most likely going to be your prosthetic material. And option two is having prolonged intravenous antibiotic, commonly in the form of vancomycin or teicoplanin. Let's do a question. A 68-year-old man with a history of type 2 diabetes undergoes placement of prosthetic hip joint 6 weeks post-operatively. He presents with a low-grade fever and mild pain around the site of the surgery. His white blood cell count is slightly elevated and the radiographs of the hip shows no signs of fracture or dislocation. Blood cultures are drawn, and after 48 hours of incubation, they grow gram-positive cocci in clusters, which are identified as coagulase negative. The organism is most likely resistant to methicillin. Which of the following features is most characteristics of the organism causing the patient's symptoms? The options are A. Production of exfoliative toxins, B. Ability to form biofilms on prosthetic devices, C. Hemolytic activity on blood agar, D. Production of enterotoxins leading to food poisoning, E. Superantigen-mediated activation of T cells. So this is actually a question that is designed to test two abilities, and it's got two stages. First, it asks you to essentially identify the appropriate bacteria with the information that's given to you. And second, after that initial identification, you are required to see which of these is correct. Hopefully, after listening to today's section, you will all realize that this is a case of Staph epidermidis, especially in the case of an implant. Therefore, the correct option is going to be option B, which is the ability to form biofilms on prosthetic devices. Thanks for listening to this episode of Bite-Sized MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.